not a taboo topic anymore.
Okay.
And actually, after my nose job, 2 weeks after I went to school, I was in med school pa noon time na yon. I went to school 2 weeks after, then they were like, oh my gosh, napa-nose lift ba siya? Ganyan, ganyan. And I was like, yeah, are you looking at my nose? Yeah, I had my nose job like 2 weeks ago, and it's really great. I mean, I'm not feeling any pain at that time. Kasi I felt pain only nung local anesthesia, that's the truth. Yung local anesthesia pag-inject sa akin, it was a bit painful. Then after that, I didn't feel anything at all. So yun. And I was like, I was telling all my friends na, yeah, I had my nose job, and kasi kilala naman nila si Daddy, and he knows he's a cosmetic surgeon, so like I could have that done like anytime. So I'm like, no, I'm not ashamed of it. And I think kasi if you make lihim pa, or if you
as a secret.
Yeah, as a secret, they would talk about it much more, I think, than rather than if you say it out loud na talaga, oh yeah, I had my nose done. And it's okay. And after that, believe it or not, like a lot of my batchmates was actually inquiring about, oh talaga, magkano pa nose job sa dad mo? Ganyan. And I was like, oh, ganito, tumawag na kayo sa clinic. O, di ba? Promotion pa.
Correct.
Di ba?
Yeah. You know, doctors, because it's always been a question that it's always been a price. You know, after asking all those possible outcome, and now it will be the price. Is the price fixed or variable in your practice, Dr. Fernandez?
Sa Shimian Clinic, it's fixed naman. Tumataas lang ng konti yung price dun sa mga secondary rhinoplasties or mga difficult cases that needs a lot of job to be done. But rhinoplasty in Shimian is open reconstructive rhinoplasty. It's like building a house from the structure, from the foundation up to the roof. All is done strongly. That will last you a lifetime.
Okay, we have a questions for our texters, Dr. JONNA.
Yes, Doc, Shimian po ba nagpagawa si Chris Taranillo? Gusto ko po ipagaya sana yung nose niya. Dr. Fernandez?
Is that a...
Patient confidentiality.
Krista is our image model.
Endorser.
Oh,
Yeah.
Endorser, yes.
Yeah, okay, so it's up to you to think about it.
Yes.
Yes, okay. Now, so we have a lot of celebrities undergoing this kind of procedures.
Yes.
Dr. ABELEDA, we know that we have some celebrities who undergo this kind of procedures, and nagiging image model nga ng clinic, yung mga pasyenteng ito. Is that just like a question of this televiewer that do they usually admitted that they undergone this kind of procedure?
Well, it depends upon the celebrities.
Yes, okay.
Of course, if they want to admit it, then they can do so. But there's touching as doctor-patient relationship that we must respect.
Confidentiality.
Confidentiality.
So we have to have like what you call like a contract or something.
Yes.
Or
Yes.
that if they want to be broadcast their procedures that were done, like for example nose job, and do you think that there's a high question when is there a lot of celebrities undergoing this or the most common procedures that a celebrity
Ako tingin ko oo.
I think so, but because of the confidentiality clause, hindi lang natin nalalaman.
Yes, we can just broadcast it to everyone.
How come it's always nose, Dr. Fernandez? I know this bulk of your procedures in the clinic is a nose job or a nose lifting. How come?
How come? Because Filipinos, lahi natin is really, we're not that gifted when it comes to the nose. So, a lot of patients seek rhinoplasty sa mga homegrown Filipino doctors because nobody knows the nose better than Filipinos.
Right.
Yes.
Kasi alam natin yung anatomy, we know how to enhance it. So, pinakamaganda is certified doctor ng Pilipinas to do our nose job.
As you said earlier, Dr. Cenica, no, the nose is at the center of our face. So, you look at a person and you basically look at his nose.
Okay, right, that's true.
So when you look at his nose and you find it, oh, his nose is really amazing. Oh, his nose is like need a little bit of enhancement. So nose has the highest impact among the facial features or facial structure, facial organs.
Okay, yeah, that's true.
So
Dr. Jonna May, you admitted in the national television that you undergone a rhinoplasty or a nose lift.
So
I mean,
funny.
as our televiewers could see, the beauty that you had right now in national television. Okay, now now that you are a rhinoplasty patient and a nose job patient, can you recognize who are the patients who also undergone rhinoplasty?
Feeling ko, it actually depends. But I think some I do recognize, but some I don't. Pero probably after my nose job, parang feeling ko lahat ng matangos ng ulo, ay, napa-nose lift yan. Hindi naman, parang joke lang yun. Pero ganon. I think it depends. Parang, meron kasing, I think meron mga tao na if you look at them directly, parang medyo halata. Or, I guess it depends upon the doctor who made them, something like that.
For me, a good rhinoplasty is yung rhinoplasty na pagkabalik mo from the 1 week period na downtime, sabihin ng mga kasama mo, parang may nagbago sa'yo.
Something different, yeah.
They wouldn't recognize.
They wouldn't recognize. That's the best rhinoplasty for me. Natural looking.
Yeah, alam mo, I would just like to add, I don't know, it's just a little technique. If, for example, you had something done on your face, it's not that you're hiding it, but just to give a little mystery, kasi ako, when I had my nose job, I also changed my hair. Pero just be sure na yung hair na ipapalit nyo is like a little bagay naman for you. So, when you go back to work or something, they're gonna say, oh, there's something different. It's probably the hair. It's not that you're hiding it, pero probably you're gonna add something that would complement what you've done.
Just like you're camouflaging
exactly.
the
You're
additional,
camouflaging.
camouflaging your beauty so that they will not always make a comment regarding a procedure.
They won't actually notice right away kasi they're gonna think, it's probably the hair. It's bagay ha, bagay sa'yo yung hair mo. Pero they didn't realize, okay, tumangos pala yung ilong niya. Something like that.
Oh, okay. Now, how about nose job who had like those, there's a lot of patients right now who undergone this injectable thing, you know, and as how you manage that, do you do advise the patient that it has to be removed right away, or do you have some patients who they have like after having this kind of injection have those blisters in the nose? Dr. Abeleda.
Some
Of course, if
problems.
there's already a complication, you have to remove the foreign body inside your nose automatically or as soon as possible, ASAP. Because usually this foreign body like the silicone oil and paraffin wax or candle, they usually are needles for infection, meaning bacteria thrives on them, specifically if infection is already inside the nose. So they have to be removed as soon as possible.
Okay. Oh, because you know that there's several cases wherein these injectable materials, as I have said, is not even meant for human consumption, and to have this kind of complications. Sometimes they form like meningocele, you know, parang bukol dito. And I've seen a patient who had like blisters in the noses, nagkaroon ng ulcerations for those who are injected. So that's why I really advise the patient, if you want to undergo a procedure, go to a doctor first and probably your primary physician, and then your primary physician will be the one to tell to you who are these experts who can undergo a rhinoplasty.
They would recommend a really certified cosmetic surgeon or a plastic surgeon.
They have to do a research on the person that will undergo.
Yes.
That will help you to decide on the rhinoplasty itself.
Dr. Fernandez, how do you convince a patient to undergo rhinoplasty?
Okay. Kadalasan our patient will come in na well-versed na sila. Alam na nila what's rhinoplasty. They search the net already. Galing na sila sa different doctors. Syempre, our selling point as doctors is yung ating past patients. So we document all our patients, yung mga before and after. And ito yung resume ko, ito yung results ko. And with that, makikita naman nila yung, wow, okay. So, that's yung pinaka-selling point namin is yun, our end result.
Dr. Abeleda, because it's very hard to convince, you know, a patient come to you is very normal. I mean, say that most of these cosmetic surgery patients...
Walang sakit.
Walang sakit. Okay. And they want to visit a cosmetic surgery clinic and, you know, subject themselves under the knife. Okay. So, it's not really just a mere prescription to have this kind of beauty, but rather subject themselves under the knife. And one thing that's very important is the most important part of the body, which is the face. You know? And the central part of the face is the nose.
Yes.
So, it's very hard to convince a patient. You slice more stage by stage and convince them.
Because it's very scary.
And one more, who are you who gonna be doing a procedure on my nose? That's why I'm asking, how do you convince the patient, not really convince, but rather explain to the patient that this is the procedure we're gonna do and who are these doctors who will be doing this procedure. Now, I know, Dr. Abeleda, you're working at Janssen and you have several cases of rhinoplasty, and these patients come to you for you to be. How do you, in your practice, how do you tell to the patient that this is the right thing to do for a rhinoplasty?
First of all, you have to show them the body of your work, meaning the previous patients that where rhinoplasty had been done, and then let them decide that, okay, we have done this before and after pictures, as what Dr. Mark told us, and then after that, you show them the positive effect of the rhinoplasty on him or her after the procedure.
Yes.
So by doing that, you can actually convince the patient. And most of the patients that we got at Janssen Clinic, they usually know what they want. So they come to the clinic. Oh, Dr. Cenica, Dr. Abeleda, I want my nose done because my cousin is teasing me that my nose is like this and like that.
Okay.
They usually know. So it's very easy to convince our patients that rhinoplasty is good for them.
Oh, okay. Right.
Yeah, just one question. Kasi some patients, kasi people are very well informed na about cosmetic surgery and rhinoplasty and everything. Are there patients like coming there? Kasi, di ba, rhinoplasty has different kinds. We have allarplasty, rhinoplasty, augmentation, and stuff like that. Are there patients who come to you saying na, I just want allarplasty, I don't want augmentation? Well, meaning na, yung kumbaga yung iba parang papabawasan ko lang to, pero ayokong itaas. Tapos, do you sometimes convince them na, no, hindi talaga yan ang problema sa'yo? Are there those cases? Like, kunyari, kailangan mo talaga ng lifting. It's not really the wideness or the width of your nose. It's actually the lifting. You need that.
Just like I've said, beauty is harmony and symmetry. Yun ang role natin as cosmetic surgeons, to really tell the patient that they need this. And hindi yung iniisip nila. Kasi it's our expertise that really matters. Yun yung binabayaran nila sa atin. That allar-based surgery lang, look what will happen if you just do allar-based surgery. Mas magiging rounded yung tip. So, mahuhuli yung something like that.
They're paying not only for your skills, but also for your opinion, diba?
Yes.
Wow.
Perfect.
It's a matter of telling them what's good for them and showing them that, if we will do what we want us to do, what will happen is like this. We can show it to them actually, and then after that, explaining on the procedure itself what procedure should be done for that specific enhancement.
Okay. Now, we have some questions wherein they said that will there be like swelling after the procedure and when they can resume work after the rhinoplasty procedure?
Concern yan ng mga patients eh.
So, right after rhinoplasty, we put tape and aquaplast, parang cast.
Cast.
So that any material, whether silicone or Gore-Tex so that it will not move. So the downtime is usually 1 week.
1 week.